Thanks for joining us at UCSF Health while we discuss nutrition management during steroid treatment after transplant. Steroids, also called corticosteroids, are a type of medication used to suppress the body's immune system and prevent rejection after organ transplantation. Prednisone is the most common type of steroid used for this purpose, though hydrocortisone or Decadron may be used instead, depending upon the patient. Some transplant recipients can eventually wean off of steroids entirely, while others may need to take them lifelong as part of their daily transplant medication regimen. In turn, the nutrition-related side effects of this medication may vary based on the length of time that you'll be taking them. In the short term, which is usually 6 to 8 weeks after your transplant surgery, common nutrition side effects include muscle loss, impaired wound healing, high blood sugar, fluid retention, increased appetite, and weight gain. In the long term, chronic steroid use can lead to weakened bones, also called osteoporosis. Let's talk about the nutritional management of these side effects one by one. While on steroids, it's important to follow a high-protein diet to help heal after surgery and to promote surgical wound healing. Steroids can also lead to muscle loss and weakness, so eating more protein-rich foods can help maintain your muscle mass and strength. Choose lean animal proteins such as skinless poultry, fish and other seafood, egg whites, and low-fat dairy products. Plant-based proteins such as beans, lentils, nuts, seeds, nut butters, soy, and tofu are also excellent protein sources. Avoid processed and cured meats, full-fat dairy, and processed meat substitutes, as these often contain high amounts of sodium and saturated fat, which can contribute to heart disease. Speak with your dietitian about your individual goals for protein intake. High blood sugar, or hyperglycemia, is a common side effect while on high-dose steroids. It's important to keep your blood sugar within the recommended range, as poorly controlled blood sugar levels can lead to impaired wound healing, undesirable weight gain, and eventually diabetes. Your pharmacist will provide specific goals and instructions for blood glucose monitoring at home. To help minimize high blood sugar levels, avoid concentrated sweets and liquid sugars such as sodas, juices, candies, pastries, desserts, table sugar, honey, and other syrups. Choose complex carbohydrates such as brown rice, multigrain breads, whole grain cereals, and whole fruits instead of processed starches and refined carbohydrates like white grains and breads, skinless potatoes, or dried fruit. The fiber in complex carbohydrates helps to slow down digestion, leading to a slower increase in blood sugar over time rather than a large spike in blood sugar that often happens after eating simple or processed carbohydrates. Switch to sugar-free versions of desserts or other treats when you can, and consider replacing table sugar and honey with natural sugar substitutes, such as stevia or agave. Lastly, regular exercise can also help manage blood sugar levels and minimize undesirable weight gain. Speak with your doctor, physical therapist, or occupational therapist for guidance on what level of exercise is safe for you to perform as you recover from surgery. Steroids can cause the body to retain more sodium, which in turn can cause the body to retain more water. Think of sodium as a magnet for water. The more sodium in your diet, the more water your body will hold on to. Reducing the amount of sodium in the diet can help maintain normal blood pressure, minimize fluid retention, also called edema, and lower the risk of osteoporosis, as excessive sodium in the diet can increase calcium losses from our bones. Sodium is just another word for salt, which is found in many packaged foods, canned goods, frozen dinners, processed meats and cheeses, sauces, and seasonings. When cooking, choose fresh ingredients anytime you can. These will be naturally lower in sodium compared to processed ingredients. If fresh is not available, frozen produce or canned goods without added salt may be good alternatives. Be sure to read the nutrient facts of any packaged foods for the sodium content and try to buy items that are 140 milligrams or less per serving. Try to cook at home instead of eating out or ordering takeout, as restaurant food is often overly salted. Use herbs or spices, citrus, chilies, peppers, or vinegar to flavor foods instead of adding table salt, salty condiments, sauces, gravies, or dressings. Steroids can increase your risk of osteoporosis or weakened bones. A diet rich in calcium can improve bone health. Foods that are high in calcium include dairy products, dark leafy green vegetables, fish with soft and chewable bones, and calcium-fortified foods. Some examples of these foods are listed on this slide. Additionally, getting adequate vitamin D is important for calcium absorption in the body. Your skin makes vitamin D from sunlight, though after transplant, it's recommended to avoid prolonged sun exposure. Instead, you may be prescribed a vitamin D supplement to help maintain normal levels. Ask your dietitian for advice on supplementation. Other ways to help maintain bone health would be to follow a low-sodium diet, avoid smoking, limit alcohol use, and engage in regular physical activity under the guidance of your doctor, physical therapist, or occupational therapist. It takes a bit of time and investment to make lifestyle changes after transplant, but the benefits are well beyond just protecting your organs. These changes promote good overall health and a longer life. Your registered dietitian is available to continue education about managing your diet while taking steroids.